Greetings, I am Joshua Atkins, a second year Doctor of Pharmacy candidate from Nashville, Tennessee, and I attend Florida A&M University. I'm here at the University of Florida for the SURF program, which stands for Summer Undergraduate Research at Florida, and I currently work at the Center of Pharmacogenomics with Dr. Julio Duarte, working on a statistical analysis of genetic polymorphisms and the association of those with pulmonary hypertension and heart failure patients. So before I get into a little bit of that, I want to take you all on a journey someplace. So be right there. Alright, I told you guys I was going to take you on a little journey. So today we're going to be at UFit, just demonstrate some properties of things that your heart can do and exercise a little bit. So come on in. I did all that just to show you all the great things that your heart and your lungs can do when they work together effectively. And there's certainly people in this world who are unable to do such things because those two systems don't work concurrently with each other. Pharmacogenomics is a study of how one's unique genetic makeup determines their response to a drug. So as you can see here, we have a patient group. They have the same diagnosis and the same prescription, but the way that they react to certain drugs is totally different. So for some people it's beneficial, some people it's not. Some people the drug is toxic, and for other people the drug is okay to be used in the body. So that all depends on the person's genotype, which is what you get from your parents with things called alleles. They make up your genotype. And the genotype expresses in a phenotype, which are the things that make it toxic or beneficial to a person. The methods that we use is we gather a study population from the University of Illinois Chicago's heart failure clinic. These patients, in order to be included, need to have a mean pulmonary arterial pressure greater than 25 millimeters of mercury and mean pulmonary capillary wedge pressure greater than 15. Their genotype using an Afrometric axiom Pan-African array, which just means we just looked at their degree of African ancestry. We analyzed the region of the beta-3 gene, upstream and downstream 20 kilobases. We found that anything to be statistically significant was defined as having an FDR adjusted p-value of 0.05, and we used RC to perform these analyses. So when it came to looking at our results, we had 66 SNPs analyzed. A SNP is just a single nucleotide polymorphism, which is a change in a specific part of the gene. We had 96 patients. 50% of these patients were female. The average age was 59 years old. The average mean PAP was 31.34 millimeters of mercury. The average mean PCWP was 20.65 millimeters of mercury, and the average TPG was 11.15 millimeters of mercury. So we can safely conclude that most of these patients in the study had pulmonary hypertension due to left heart failure, because these values in this chart are far exceeded by the ones in the results. So looking at the association that we found that none of our SNPs were statistically significant after the FDR adjustment was made, but before that we had some really significant SNPs, and these were our four strongest. And so you can see that two of them had associated with an increase in mean PAP, while two were associated with an increase in mean TPG. And so you can tell it's an increase by the beta value. You have really good p-values. In conclusion, association between pulmonary hypertension and the SNPs could possibly exist. However, there's going to be a lot more data needed in order to make that a concrete statement. This study could probably benefit from an increase in power, just because there weren't a lot of people in the study to be used, and increasing that would help a lot. Hey, I didn't see you there. Well, thank you for coming on this journey with me. I wanted to give thanks to the College of Pharmacy, the University of Florida, and the University College of Pharmacy Center for Pharmacogenomics. I also wanted to give special thanks to Mike Nazareth, Dr. Julio Duarte, and Provost Joseph Glover. Thank you for believing in me, and thank you for everything that you've done this summer. Thank you.